Quit smoking's a big deal. Quit smoking and weight loss. We do a lot of that. With the quit smoking, there's some points in the ears that we stimulate. And we can actually use a thing called a staple. We put a little staple on the inside of the ear, and it goes in kind of like a C. So this part's in the skin, this part's in the skin. And it's like taking an acupuncture needle from the top and the bottom. But with that staple, it stays in there. It stays in until we take it out. Okay? So it's constantly giving stimulation to those points. And what it does is it helps to decrease the addiction to the nicotine, decrease the cravings, and also helps with withdrawal symptoms, the stress and the anxiety. With smoking, I mean, you still got a lot of psychological issues. The smoke, the cigarette is your buddy. You're used to doing something in the hand, something in the mouth. So you still have to work with those a little bit. But at least with the staple, it helps you get through it. Okay. What we do in our office is we put that staple in, and then we stimulate some other points. We cover all the follow-ups for an entire year. Okay. So once you put the staple in, you can come back as much as you need to for the entire year for free. After you pay for the initial, and then it helps, like I say, it helps you get through it. So if you have a tough time, let's say 6 months from now, you come into a stressful situation, and you come back into our office, we'll stimulate some of those points, and they'll bring it back down. So we've probably got about between a 75 to 85% success rate with that.
That would be something that we would allow in your ear. Make them take piercings out that are up there, we would allow that.
That's right. Yeah, and we do the same thing with weight loss too. There's some points we put the staple in, stimulates metabolism, helps decrease appetite, and decreases cravings. You get about an 80% success rate with that.
I know how much chiropractic care runs, but acupuncture is comparable.
Guys, when you ask a question, kind of speak up a little bit so ladies in the
I'm
back.
sorry, I was asking how much a usual treatment would run with acupuncture as compared to chiropractic.
Right. So cost-wise, normally if you just went to an acupuncturist that wasn't an MD or a DC or a chiropractor, it's usually about $60 to $75 a visit. Okay? And since insurance doesn't cover it, usually people pay for that out of the pocket. Okay? Now, since I'm a chiropractor, most of the stuff that we see, we do chiropractic in combination with the acupuncture. So a lot of the stuff that we do is covered by the insurance company, so we turn that in under the chiropractic, and then we just charge a little bit extra for the acupuncture. Usually between $10 to $20 for the acupuncture. So that's all you have to pay out there, plus whatever your co-pays are and what have you. When it comes to weight loss and stop smoking, nobody's covering that yet. But for the staples, we charge $225. That's the first visit, but then you get a whole year's worth of visits for free. Some like Boston Freedom. Okay, we'll get you to stop smoking. We'll pay for it.
Does it come in pink?
They don't have it. Just metal color is all we got right now. Now maybe you can paint it. I don't know. I haven't tried that yet. Yes, ma'am.
Do you place the staple in the same area for the weight loss and the smoking?
It's a little bit different. It's close, but they're both on the inside portion of the ear. So it's not on the outside, and it's not real noticeable. But the points are real close, so you can't really tell much of a difference, but it depends on where we put is what the effect's going to be. Any other questions?
Dr. Thayer, can you, go ahead. Go ahead.
Have you ever done any work with autism?
Yeah. Yeah, with autism, yeah, we have. It helps a lot. It's a tough situation with the autism, but there's a lot of things that we do, both chiropractic, because we're looking at, make sure the nervous system's functioning at its best. But with the acupuncture especially, there's points that we can hit that helps to, keep them a little calmer, keep things a little more under control. Yes, so Donnie?
Can you tell them if they came and worked in your clinic as an MA, what would they be doing?
Okay. Okay, so if you came to our site as an extern, the main function you'd be doing is helping a lot with the physical therapy modalities, which would be, I would go in and see the patient, and then you apply like electrical muscle stimulation, heat, ultrasound. I've got a machine that we use to help rub the muscles out, and then also taking out some of the needles, the acupuncture needles. So that's the main function. Then we always have different little things that come up. We do little different things. What I try to do too, whenever you come in as the extern site, I try to help you to understand a little bit more about what the acupuncture is, what chiropractic is. So if I have different cases, I'll bring you into the room and show you what we're doing. And like, for instance, the inducing labor yesterday. I brought the extern in to see what we're doing differently than what we do with somebody with low back pain. You know, my philosophy is the more you know, the more you learn, the more you understand, the more valuable you are to yourself, and then also to the rest of the community. You know, seeing just some of the other options that we've got out there. So, and a few days, you know, during the externships, I usually have you just follow me around. We just go from patient to patient and see what we do with the patients. You know, and then a lot of times we'll mix things up too, and we can do some file things, and you do some, you know, blood pressures and, you know, that kind of stuff, the normal stuff that we do. So, but we try to keep it interesting at the office. You know, no 2 days are the same.
Yeah, we frequently learn a new skill set. And the students always say the same thing, oh my God, he loves to teach, it's so interesting. So, and it's an interesting topic.
Yeah. Yeah, you know, when you're dealing with the acupuncture, you're seeing a lot more things than just the normal chiropractor. You know, most chiropractors, it's low back pain or it's neck pain. You know, and that's it, you know, for the most part. Maybe you might get some little tingling in the fingers. Well, that comes from the neck, so they work on the neck pain. With the acupuncture, we see, you know, the autisms, we see, you know, fertility issues, we see, you know, liver problems, kidney problems, you know, people can't sleep, insomnias, you know, so we get a wide variety of things that walk in the office. That's what makes it fun. Any other questions?
Right.
Oh, yes.
Okay, with the pregnant girl,
Uh-huh.
what points did you hit? Because I saw something online back when I was pregnant and I was trying to go in labor. And it had like places in the foot and behind the ear. What points did you hit on her?
Yeah, so with her, there's some points on the hands, some
Yeah,
points
we
down
had
on the
that too,
leg.
like right here
Uh-huh. Yeah, it's right here.
and like
There's a couple on
behind
the
your
legs,
ankle.
behind by the knee, yeah, one down there by the ankle. And there's some points in the ears that we stimulate too.
So did you just do needles or did you massage? Because online they had massage.
Right. You're going to see a lot of stuff about what they call acupressure, you know, because you can't really do acupuncture unless you're licensed to do it. You know, so, but acupressure you can do. You know, you go to those different things and put pressure on it, which it works. Acupressure works. Acupuncture works a little bit better, you know, because we're actually piercing the skin and we're stimulating the nervous system a little better than you can just by rubbing it. But yeah, but by rubbing it and doing acupressure, you can get some good results with that. So, did it help any?
I ain't pregnant no more, so it don't matter.
There you go. Okay. All right, any other questions? Okay, so I've got these folders that I passed out. I ran out of them, so I'm going to give some more to Dawn. The next few days she'll get some more. So if you guys, you know, want to talk to Dawn about getting some more, you know, if you can get one, we'll get one for you. We've got a website. It's drthayer.com. A lot of information on there, both chiropractic and acupuncture. We're getting ready to launch another, like almost doubling our website, hopefully in the next 2 weeks. So we speak, on our website right now, we speak a little bit about acupuncture, but soon as we're talking a lot about acupuncture. So there's a lot of information on there. You can always send us emails. If you have any kind of questions, you know, email us, you can call us. We've got the 2 offices, one in Edwardsville, one in Highland. And there's always somebody on the phones, even if that office is closed, they're transferred to the other office, but there's always somebody there to answer the phone. So thanks for having me out. Hopefully you guys learned a few things.
And this is all just